Hello everyone, good morning. Hope your preparation is going well. So once again, I am here to help you in your preparation. Welcome to my channel, Icons of Nursing. You can join our Telegram channel through this link. Link is given in the description box. There you can get so many previous year's papers and previous year image based and MCQ and live quiz. Every Sunday we are organizing a quiz, so you can join the Telegram channel also for your preparation. Okay, so here I am going to share some of the key points which will help you in the preparation of the NORCET. So here I am going to start. So here you can see Nursing Officer Recruitment Common Entrance Test. From the 2022, AIMS has organized a Nursing Officer Common Entrance Test which is held all over the India. Okay, so every year it is held in the month of the September. Total number of questions that is 200 and duration of exam that is 180 minutes they are giving. This year 2023 date of exam for the 2023 date of exam that is 17 September 2023. Next we can see for the NORCET preparation we have some of the major subjects from where the most of the questions they are asking. Some of the major subjects also there and some of the moderate subject and minor subjects. So if you are covering most of the major subject, major and moderate, if you are able to prepare able to cover your preparation of all the subjects major and moderate, so it will help you more. And by this only, from the major and moderate only, you can able to solve the most of the 60 to 80% questions of the NORCET. So here you can see the under the major, that is first, that is medical surgical nursing, MSN, including the anatomy and physiology of each respective system. Next we have fundamental of nursing. Third we have OBG. Fourth we have pediatric nursing, and fifth we have psychiatric. This year in 2023, so many questions they have asked from the psychiatric and pediatrics. So each year they are changing, but the major subject is fixed. Okay. Next we have moderate subject like community health nursing. Next we have research, pharmacology and anatomy physiology. And in the minor section they are asking nutrition and biochemistry. From the nutrition and biochemistry, mostly they are asking the vitamins, vitamin deficiency, their sources and deficiency and disease. Microbiology, mostly they will ask the sterilization and autoclave part and all this, and regarding the gram staining and bacteria and all that they will ask. And in next we have genetics and pathophysiology. Next we have nursing education and nursing management. Okay, next we can see other subjects. From the among the 200 questions, they will ask 20 questions from the other subjects, like from the GK. You can cover the GK from the whatever the recent any games, sports, and any PM Modi has organized any recent health programs or any recent advancement they have discovered. So you can go through that. So that will help you to get the proper idea regarding the GK questions. Next we have English. English, they will ask the spelling corrections questions. Sometimes they will ask synonyms, antonyms, and some of the questions they will ask from the grammar. And from the computers also they will ask 2-3 questions. And maths also they will ask some of the reasoning question and some of the calculations, profit, loss, percentage, like that they will ask. Okay. Next we can see that. So what all the book and references you will go through, so that will help you. So Target High is the most, so you, as you all know, the Target High is the most preferable book for all the competitors or all the nursing, for all the nursing competition exams. So Target High must you should refer for all the major and minor subjects. Next we have PR Yadav. Okay, so you can easily go through the volume 1 and volume 2 through the PR Yadav. And thirdly we have NCLEX Saunders. So here you can solve all the reasoning type questions, and it is some of the most advanced type of book. So you can go through this book also. That will helps you to clear your concepts more. So here you will get all the clinical based questions in the NCLEX. So it will help you to clear your concept. So next we have most probable topics. So here I am going to share some of the most probable topic, mostly 50 to 60 topic that will help you to cover 60 to 80% of the area of the NORCET. Okay, so from this topic only repeatedly they are asking the most preferable and most probable topic this is. So if you are having strong cover on this topic, so that will help you make your preparation easy. Okay, so first topic, that is biomedical waste. Each and every year they are asking 4 to 5 questions from the BMW. Okay, next we have ABG. So they will ask they will give some of the interpretation. They will ask what is the interpretation. Nowadays they are asking compensated and uncompensated. So you can go through all that. And in the ABG also they will ask some of the abnormalities, cases, and normal values, and they will give the interpretation of the ABG analysis. Next we have ECG interpretation. They will give some of the pictures and they will show, they will tell what is that interpretation shows. So most of the time they are asking some of the electrolyte changes in the ECG, like what happens in the hyperkalemia, hypokalemia, hypercalcemia. So you can go through all the ECG changes during the electrolyte changes. Next we have immunization. From the immunization, most of the 4 to 5 questions they are asking. Cold chain, from the cold chain they will ask VVM, vaccine while monitoring. They will ask the route and dose. Most probably they will ask the route. What is the route for the MMR, what is route for the PCV, what is route for the OPV, they will ask. And regarding the dose also they will ask. Some of the questions they will ask from the, next we have volume and drop factor and drug calculation. So this year only, previous year 2022, they have asked 4 to 5 questions regarding the drug calculation and the volume and drop factor. So you can go through the minor and major drip set, what is the drop factor we are taking, and you can do the drug calculations. Next we have CPR. So they mostly they will ask CPR regarding the instrument also they can ask, regarding the ratio value they will ask in the adult case, in the 2 rescuer, in the single rescuer. So you can go through all that. Next we have neonatal resuscitation. Neonatal resuscitation, they will ask the mask size and the proper placement of the mask and mask over the face, and they will ask the mask size, and they will ask the rescuer ratio and all that. Okay, next we have emergency drug dose, route and actions. In the emergency drug, you can see that some of the emergency drug they will ask frequently, like they will ask from the adrenaline, what is the dose for the adrenaline. Some of the emergency drug you can note down, that is adrenaline, lithium, MgSO4 they will ask, atropine, dopamine, dobutamine, phenytoin they will ask some of the side effects of the phenytoin, digoxin they will ask, and antidotes also they will ask, drugs and antidotes, they will give some of the drugs and they will ask what is the antidote for that drug. So 2-3 questions approximately you will get from the drugs and the antidotes. Next we have emergency nursing and triage nursing. So they will ask the color coding, how you will triage, and they will give some of the cases, so they will ask under which triage this patient will come. So like that they will ask. In the critical care nursing, they will ask some of the procedures also in the critical care, and they will ask regarding the sutures, what is non-absorbable and absorbable sutures, what all sutures comes under, and they will give some of the blade size. They will ask, they will show the image based questions and they will ask the blade size. Next we have GCS. In the 2022 they have asked approx 2-3 questions regarding the GCS. They will give some of the scenario, like patient having they will ask the low score of the GCS and highest score of the GCS. They will give some scenario like patient having slurred speech and only verbally responds towards the pain, so what will be the GCS value, like that they will scenario they will give, and they will ask the what is the score for the patient. Next we have suctioning, they will ask the suctioning tube pressure and gauge of the suction tube and size of the suction tube they will ask. And regarding the ET intubation, they will ask cuffed, uncuffed ET tube, what is the size, what is the formula for the ET intubation, and all that they will ask. Oxygenation also they will ask, some of the times they will show the high flow rate oxygen, and nasal cannula they will ask what is the FiO2, how much liter they will deliver. So regarding all the oxygen administering method, they will ask some of the things. Next we have SOC and its type. So you can see SOC and its type, they will ask regarding the different types of the SOC, what is the management of the SOC, so you can go through all that. So regarding the anaphylactic SOC also they will ask what is the drug of choice of the anaphylactic SOC, what is the drug of choice, and all that they will ask. Okay, next we have surgical instrument and articles. So you can see surgical instrument and articles. So how you will learn the surgical instrument and articles? What I used to do, I used to prepare a gallery. In gallery I used to prepare a folder of the surgical instrument and articles. Okay, what I used to do, so I'm going to share that, so it may help you. Okay, so I'm just preparing a folder in my gallery. So what I will do, every morning and every before going to sleep, so in morning and at the bedtime also, I used to just scroll down all the images of the surgical instrument and the articles, whatever I have supposed to make that folder. So it will help me to recall each and every day. So after 10 to 15 days repetition of the recalling or sliding, going through all the images, it will help me to recall, and it helps me to gain the helps to retain all the names for the surgical instrument on the articles. So it may help for you. Next we have vital signs. So they will ask the types of the temperature, types of the pulse. They will give some of the kinestroke pulse and abnormal pulse, like so many types of the pulse they are asking. They are showing some of the images and they will ask. Okay, next we have respiration. They will ask abnormal respiration, sound respiration. Okay, BP. Next we have, they will ask some of the BP measurements, systolic, diastolic, pulse pressure, what is pulse pressure, pulse deficit, and they will ask some of the things like mean arterial pressure, what is that. So they can ask anything. Next we have pain. So they can ask some of the types of pain, like phantom pain, recurrent pain, referring pain, referred pain, like that they will ask. Next we have temperature, types of fevers. They will ask hypothermia, hyperthermia, what is the temperature for the hyper and hypothermia. Next regarding the pulse, they will ask pulse pressure, pulse deficit, site of pulse, pulse pattern. They will ask like kinestroke, and many of the types of the pulse is there, so you can go through that. In the respiration, they will ask abnormal lung sound, abnormal characteristic of the respiration they will ask. And next we have pain. Okay, pulse types also you can go through all that. Okay, next we have pain, types of pains they will ask, important health dates and the themes. This is very important. mainly you can see 2-3 questions each and every year they are asking regarding the health dates. What is the date for the World Malaria Day, World Rabies Day? What is the theme for the World Health Day? On which day we are celebrating the Indian International Nurses Day? Like that they will ask some of the theme also of that year. Hand washing day, like that they will ask. Next we have injections, different routes and sites they will ask. What is the different routes for the injections, IM, IV? What is the different angles at which site we are giving, needles and cannula? You can learn all the cannula size according to the color code. Next we have vitamin, they will ask the source and deficiency and abnormalities. Family planning and the contraceptive method, you can go through the community book, and you just have to recent update and latest idea regarding the contraceptive method. What all the changes done by the government, what all the new intervention or new contraceptive methods is implemented by the government of India, and all that. Next we have burns and fluid calculation. So sometimes they will ask the fluid calculation, so you can go through that. And positions, regarding the positions they will ask in this surgery what all positions we will provide and what all positions they will provide post operatively, pre operatively. So you can go through some of the most of the positions. So they will ask some of the, like if child is having the cleft lip palate, what all positions we will provide to the child, and jackknife positions, Fowler's position. Regarding they will ask when we will provide the Trendelberg position, reverse Trendelberg position, and all that they will ask. Next we have disinfectant sterilization. So they will ask some of the sterilization procedure, autoclave procedure, heat under pressure, what is the temperature, how much time we were keeping. Next we have probable, presumptive and positive signs of the pregnancy. So here you can see they will ask the probable, presumptive, positive signs of the pregnancy. They will ask Osiander sign, Jackmere sign, and all that. Next we have amniotic fluid. So if you are going through all the color abnormalities, all the color, they will ask regarding the mucin stain, which color it is. During RH incompatibility, what is the color of the amniotic fluid? They will ask. Regarding the oligohydramnios and polyhydramnios, they will ask. In the fetal skull also they will ask anterior posterior fontanelle, at which time it is closed, what is the size of the, what is the shape of the fontanelle. Regarding diameter also they will ask biparietal diameter, submento vertical, submento pragmatic, like that they will ask the diameter also. In the pelvic also they will ask the diameters and the landmarks of the pelvis and types of the pelvis, like android, platyploid and gynecoid. Regarding all the types of the pelvis you should also be familiar. And regarding the shape abnormalities also, Naegeli's pelvis and Robert pelvis, like that they will ask. So health statistic also they will ask some of the times, recent IMR, MMR, what is the ratio, what is the formula for the IMR, NMR, and under 5 mortality rate. Regarding that also it will help you. And regarding the IV fluids also they will ask the types of the IV fluids, crystalloid, colloids, and hypertonic, isotonic, which fluid is comes under which. So they will ask some of the things. And regarding the blood transfusion also they will ask the what is the what you will do after the reactions and all that, what is the size of the, how you will differentiate the blood transfusion set and IV set, like that. And TPN also they will ask what is the constituent and components of the TPN. And exchange transfusion, at what time we are doing the exchange transfusion, what is the formula for the exchange transfusion, single volume, expander, and double volume, like that they will ask. So this all the main of the topics. This is the most probable topic. So if you have you are definitely, if you want to score properly, score highest rank in the NORCET, so if you have strong cover on this important topic, definitely you will get. Okay, so this is all the most probable topic for the NORCET. So hope it will help you. So next we have some of the key points to remember while preparation for the NORCET. So first you can see, finish the content of the major subject, whatever the major subjects I have shown you. So finish all the contents of the major subject. So don't go on studying. Okay, just list on some of the strong subject, whatever subjects you like and whatever subject you don't like. Then you just see the whatever the major subjects of the NORCET, for the NORCET preparation. List on your weak points also, weak topic also. Make it strong by the repetitive revision. Whatever your weak point, make it strong by the repetitive revision. Next we have cover MCQ of the respective topic on the same date, whatever topic you are studying. Like if you are going to finish the cardiovascular system on the Monday, so on the cardiovascular system, whatever the MCQ of the cardiovascular system, you just have to finish all the cardiovascular system related MCQ on that day only. So it will help you where you are lacking and what is your strength and weaknesses of that topic. Okay, so cover MCQ of the respective topic on the same date. Watch with whatever topic you have read on that day. Okay, fourth point, you have go through at least 4 to 5 previous years papers. Okay, whatever the nursing officers paper and previous years NORCET paper. So analyze the topic. So from the previous years papers only you can write down the whatever the topic, what are the topics they are asking repeatedly, pattern of the question you can go through. Okay, so that will help you in your preparation. So next you can daily go through once all the image based questions, surgical instrument and medical equipments. So you can prepare a folder in your gallery, so you can just swipe it out once or 2 times daily. Okay, so after 10 to 15 days you are able to recall each and every instrument and articles. Okay, next we have daily practice at least 50 to 100 MCQ. Okay, daily practice at least 50 to MCQ, and join any of the online or offline test series and evaluate your preparation and performance. Okay, this is very important. Just join any of the online test series that will help you or evaluate your preparation. Whatever your weak point, just make it strong, so that will help you to prepare and boost your preparation. Okay, so thank you so much. After all this, I just want to recall each and everything. So here I have shared some of the important key points that will help you in your preparation. So I'm planning to make one more video that will that is subject wise. I will sort out all the subject wise important topics, so that will help you to get more idea regarding the subject wise what all topics you have to focus more. So thank you so much. Keep contact and keep touching. Just share this video with your friends, whoever is your friends is preparing for your NORCET. So thank you so much.